so it's the current research shows that certain viruses, and there's no way to predict it and there's no way to prevent it, right? Which was a hard lesson to learn. Certain viruses will, for one reason or another, attack the pancreas. So it is a genetic disorder. You are predisposed to type 1 diabetes. But theoretically, you could go your whole life having diabetes but never actually have any symptoms. So the current theory is that certain viruses will attack your pancreas. So you'll just be sick, but it will also be attacking your pancreas, and it will trigger this disorder. And so, anyway, that's a current theory. There's no proof, obviously, but at least not yet. But there's all of the type 1 research that we've seen, they're pretty confident that that is what it is. And so Henry just got unlucky in that he was 3 years old and he got sick in this certain virus. And we learned that at the hospital that there are a lot of children, usually it's not younger than 18 months. That is very, very rare that a child will have their onset. So like with Henry, 3 years old is still really young, but not ridiculously unusual. So yeah, unfortunate, and then you go through if I had just not let him get sick, then this wouldn't have happened, but that's, there's no way. How do you prevent a child from getting a virus? So from my understanding, it's really common, not really common, I shouldn't say really common, but a lot of kids, it's like 3rd, 4th grade, it'll happen. But but yeah, there's no definitive age where someone's more likely or not, at least from my understanding. So the research that I've done. So.